My name is Ron Romanelli. I'm an orthopedic surgeon. Been practicing for approximately 29 years in Springfield, Illinois. In 1998, we became the Orthopedic Center of Illinois, and I really saw our group just develop and blossom. And so we have a very large following, a lot of orthopedic patients we've been privileged to take care of through the years. And then came up with this Lloyd Wright design where we have 50,000 square foot building here, but the most important thing about our building is that we're able to have everything under one roof. So we have our physical therapy, we have our MRIs, we have our imaging, our x-rays. Patients can come in, they can be seen, they can be diagnosed, but at the same time we get all of our imaging at the same place. So it's very convenient for patients. We make sure that it's all about patients here. Our service is better than a lot of the other facilities in town and around the country just because I think we are so patient oriented. So it's been a great community, raised my 3 boys here, and it's just been a great place to live, and it's a great place to work. I think that I'm very happy that I spent my career in Springfield just because I think the people we take care of are very willing and wanting to get back to work. So when they see us, we can fix them. They want to go back to work, and it's a little different than the big city. But yet we actually have everything we need in this town. We do everything. My partners and I have all the different specialties covered. And with that, we can do everything they can in St. Louis and Chicago right here at home. So my interest and my passion is to mainly do hip, knee, and shoulder arthroscopy as well as reconstructive surgery. So I like that specialty because I can see people coming in and they can hardly walk, whether they come in with their walker or their wheelchairs, and we can do joint replacements and they can walk out without pain and discomfort. So I've really gravitated to those 3 specialties. Joint replacement right now is state of the art, and we really have rapid recovery techniques for our joint replacement. So most people are either outpatient or in the hospital overnight just because of our techniques that are so good. So we do a thing right now called prehab, and that's rehabilitation before surgery, because then our joints will go home sooner, they do better, they perform better. So we send them to physical therapy ahead of time. Non-operative treatment for osteoarthritis would be cortisone injection, anti-inflammatories, and that therapy. So when that fails and when their quality of life goes downhill, that's time for a partial or a total knee replacement. Afterward, we have a very rapid recovery process where we get people up the same day of surgery. Now everybody's walking 6 hours after the surgery, and you'd think that that'd be very difficult, but when you do a knee replacement and you remove the pain, then all of a sudden that pain goes away. So people have surgical pain, but we usually block that with numbing medicine as well as a special block we do called an adductor canal block, and that pain relieving from numbing medication usually can last up to 24 hours. We also start our pain medicine ahead of time, so we have this preoperative pain control going, and that I think helps people's rehabilitation afterward. And it's very rewarding to me to see somebody come back in and 2 weeks out. I just saw a lot of patients, 2 weeks out, they're walking, no cane, no walker, incision looks good. And the last thing we do is we've been using super glue on the skin with this perineal dressing, and it's very nice because you can shower the next day and get the ice to the knee or the hip, and so that works very nicely. So if you have any questions, please visit our Orthopedic Center of Illinois website at orthocenterillinois.com.